Hello friends, I am Rashmeet and you are watching Patient Education Series on Cancer. Earlier, cancer was dubbed as the death sentence for the person diagnosed with it. But now, it has become more manageable through treatment. Yet, we cannot ignore the fact that cancer has no fixed criteria. It can happen to anyone, anywhere, at any age. At present, there are a rising number of cases with intestine and prostate cancer in men, which is a serious issue. This episode focuses on the understanding of these cancers in men, that is intestine and prostate cancer, with the help of our honorable expert, Dr. V.P. Gangadharan. Dr. V.P. Gangadharan is a world-renowned oncologist, a fellowship holder from NCI and WHO. He has pioneered the idea of blood stem transplantation in Kerala and is the founder of the first medical oncology department in Trivandrum. He is the father of Cochin Cancer Society, a charitable institution that helps patients physically, mentally and financially. It is his pledge that no patient should go back without treatment due to lack of money. Dedicated to serve the humanity, he has launched the campaign to eradicate cancer completely and has been educating the people about prevention, early detection and treatment of cancer. An author of over 35 publications, he has received several awards till date and has been felicitated with Indira Gandhi Puraskar and JCI India Award for outstanding contribution in the field of medicine. Today we have the pleasure of having Dr. V.P. Gangadharan on our show, and we will talk to him regarding the cancer of the intestine and prostate. Welcome, Doctor.
Thank you. Thank you very much.
Doctor, let me begin by asking, what are the signs and symptoms of prostate cancer?
Of course, most of us might have heard about lung cancer and head and neck cancers. But what about prostate cancer? I think it's again going up. There is most of the statistics quotes to say that the incidence of prostate cancer in males are going up. Of course, we have to immediately say that prostate cancer can occur only in males because females cannot have prostate cancer. The common warning signs are, we have to remember, is an increased frequency of micturition, especially at night. That is, the patient says that I have to go at least 8 to 10 times, wake up and then go for my to the toilet. And it disturbs my sleep. It's a commonest symptom by which they come back and tell you. And they may come and tell that I get a feeling that my bladder is not fully emptied. I go for urination. I get a feeling that the emptying is not complete. Or sometimes it can be an overflow. That means the bladder is full and it's overflowing. It's again one of the commonest symptoms. Or repeated urinary infections. So the patient coming with repeated urinary infections. That's again one of the warning symptoms of a prostate cancer. But you have to immediately remember that all these symptoms can happen in something called a benign prostate hypertrophy. That means which naturally happens in the elderly age group, where the prostate goes for hypertrophy without getting malignant. The same symptoms can be there. So, just because that somebody is having a symptom doesn't mean that this patient is having a prostate cancer.
Is there a program for early detection of prostate cancer?
The screening program for prostate cancer is again very good, very simple. Above the age of 50 years, there is a good tumor marker called as a prostate specific antigen, PSA, which has to be tested annually to look for any rise. Equally important is a good digital rectal examination done by a competent clinician, because he can correlate both. That means he can correlate the rectal examination plus PSA and almost try to say that yes, probably you are having or you are not having a disease, which has to be confirmed and then going for treatment.
So doctor, what are the treatment options available?
Treatment-wise, prostate cancer I think can divide broadly into a purely localized disease or as a disease spread to other areas. If it's a localized disease, you've got a treatment option of going for surgery as well as a treatment option going for radiation. When it has spread out disease, still it's possible to have a good treatment and go for a good quality of life. the treatment option at that point of time is to go for something called a hormone treatment. You have to remember that the prostate cancer, especially in the early stages, they are under the influence of male sex hormones. So if we can cut off the food supply to the prostate cells, their food supply is actually the androgens or the male sex hormones, then they get starved and they die. So your option is you can cut off the androgen supply by removing the testicles as one option, or you have got drugs which can block the androgens and try to starve the cells. So this is possible as part of hormone treatment. So in early stage disease you treat by surgery or radiation, and advanced stage is usually taken care of by going for a hormone treatment. But one important thing to remember is prostate cancer is actually a very slowly growing tumor. So a very elderly patient diagnosed with prostate cancer need not be scared of the disease, saying that you are having a cancer and you are going to die immediately. No, it's not like that. So very elderly patients can be easily tackled by hormone treatment alone and give them the normal lifespan that they are going to get even otherwise.
Can you prevent the cancer of the intestine?
Now the large intestinal cancers, that means the colorectal cancer is again on the rise in males in India. If you say, actually, can you prevent it? That's the first question to be asked. Can you prevent a colorectal cancer? To a certain extent, yes. You have to modify your diet, especially the dietary habit which has got a proneness for the development of this cancer is a high fat, high calorie, low residue diet or a low fiber diet. Because when it comes to a high fiber diet or a high residue diet, what was happening was they used to take care of all the toxins. But when that's not there, these toxins, many of them are carcinogenic. That means they can result in the development of a cancer. They can get absorbed and they can produce the cancer. So if the diet is going to be a high residue or a high fiber diet, the chance of developing a colonic cancer can be prevented to a certain extent. That means we have to go more for the high fiber, high residue diet, which was our habit before. But now we are getting more and more westernized, and that is how the incidence of intestinal cancers are high or going high in India also.
Is there a program for early detection?
Colorectal cancers again can be screened, and the usual screening is actually with something called a fecal occult blood test. That means you are losing blood unknowingly through your motion, which can be tested called as a fecal occult blood test. A colonoscopy, whereby you are examining the intestine, again helps you in going for an early diagnosis. The problem that happens mostly as a common problem is we try to label all bleeding per rectum as piles. So our diagnosis is piles, and you go on going to different doctors treating them as piles. But what happens is piles may be there outside or may not be there, but inside a growth goes on and which you are missing. So if there is a history of a bleeding PR, definitely go and rule out the possibility of a colonic cancer, because that need not be labeled as a piles and going for treatment.
What are the treatment options for the cancer of the intestine?
The treatment options in colorectal cancer is, the primary treatment option is surgery. So based on where exactly is the tumor, and based on the stage of tumor again, I think sometimes you may be able to maintain the integrity of the intestine so that the motion can pass through the anus itself. But suppose the tumor is a very low lying tumor, you may not be able to preserve the normal anatomical function, where you may have to go for something called a colostomy, because you may not be able to maintain the continuity of the intestine at that point of time. So depending on the site of disease and the stage of disease, the treatment goes for surgery, radiation, and chemotherapy becomes mandatory, especially in a not in a very early stage, but of course in the intermediate stage and in an advanced stage, chemotherapy becomes mandatory.
Doctor, thank you so much for explaining prostate and intestine cancer and sharing your knowledge with us.
Thank you.
This episode has been quite insightful for all of us. But if you still have any queries, do write to us at Department of Medical Oncology, Lakeshore Hospital, NH47 Bypass, Maradu, Nettur Post Office, Kochi, Kerala 682040. You can also call us on 984-706-4668. You can also email us on drvpgangadharan@gmail.com. Friends, today we discussed about cancer of the intestine and prostate. But our next episode will have a lot of other information about other cancers. See you in the next episode. Till then, take care, be alert, and get aware with Patient Education series on cancer.